What is high-risk smoldering myeloma? Compared to low and intermediate risk smoldering myeloma, patients identified as having high-risk smoldering myeloma have a significantly higher rate of progression to active myeloma at 2 years. The definition of what criteria should be used to identify someone as having high-risk smoldering myeloma has been evolving over time and will continue to do so as more is learned.
High-risk smoldering myeloma is a definition that's changing right now. We don't actually have a good answer for it. In general, we use markers like how high is the M spike, how high is the light chain ratio, how much tumor burden they have, meaning the bone marrow involvement. And you can have different markers. So the old Kyle criteria or Mayo criteria was based on certain numbers, and this was updated by the 2020, which is now trying to redefine it so that we can understand better and talk to each other. However, in general, those are all markers of tumor burden, and we need better markers. We just put together the genomic data on trying to redefine smoldering myeloma and having genomic markers of high risk disease so that when we can use these numbers, you can actually be more accurate in saying who is truly going to progress to overt myeloma.
What are the two 2020 guidelines for smoldering myeloma?
Smoldering myeloma high risk to 2020 is a new classification that came along after we removed, in the old days, what we called ultra high risk smoldering myeloma, were the people who had a very high risk of developing myeloma. So 60% plasma cells, having a light chain ratio that's very high, like over 100, and having multiple lesions on an MRI or a PET CT scan. These categories are now taken into overt myeloma, and we treat patients when they have those numbers. So we started saying, well, can we redefine what is going on with the smoldering myeloma? And this is when over 1,000 patients were put together by the International Myeloma Working Group, and it came with the definition of 2020. 2 grams of M spike, 20% plasma cells in the bone marrow, and a light chain ratio of 20 or higher. I think it's a great definition. It's not good enough. We need better markers because 2020 is still defining light chains, bone marrow involvement, and M spike, and these are just tumor burden markers. We need to understand the biology better.
Are the two 2020 criteria considered standardized guidelines for diagnosing high-risk smoldering myeloma?
They're not considered standard because we're still trying to define smoldering myeloma. I say it's probably a new definition that we can use, but we need to add to it. And there are so many other factors that are not included in this definition. High-risk cytogenetics is very bad, and we need to make sure that we have that data involved. Evolving M spike, if there are light chains or their M spike keeps increasing, I think that's such an important factor. Let's not forget about that. So in general, in clinical trials, we're saying we will use 2020 and other factors to make sure that we're including everyone and we're not oversimplifying it and removing so many other important factors in high-risk smoldering myeloma.